Hi ladies, I have a few updates. I wanted to do this in a video because it was going to be a really long message. So real quick, while we do have radial blood pressure cuffs now, hooray, I would still encourage you guys to try and use our regular blood pressure cuffs if they fit the patient. If you have a patient they just don't fit, you can use the radial, but please remember that you need to have the patient put their hand at the level of their heart to get accurate readings with those radial blood pressure cuffs. Biohazard bags. We're finding them everywhere with all sorts of things in them. Please remember, these are just for labs and biohazard material. So if you're sending a medication back to pharmacy or storing crayons in them or anything else of that sort, please use just regular Ziploc bags. We have all sorts of sizes stocked in our clean supply rooms, and I also have the little tiny ones in our medication room. We also have new fetal monitor carts for our ORs. One of them has already been placed in OR2. It's so pretty. If you guys notice anything not working on it correctly, please let me know so that I can pass the message on to Mickey. Our other cart should be ready to go into OR1 shortly, hopefully. We've also been informed that there are some duplications on HealthStream. So if you notice that you've been assigned the same thing twice, do not fret. They're working on getting those removed, hopefully within the next week or so. I have made, well, Catherine has made some blood administration folders for each of our rooms. They're awesome. So on the front of them, there's a whole tip sheet of walks you through the whole process step by step. And then inside there is the blood administration informed consent that your provider needs to sign. On the other side, there is a blood administration brain, you could say, that reminds you all of the steps that you need to do in Epic. And then you can write your vital signs down on it as well. I've also put in some C-section consents behind the blood consents per Dr. Orr's request. So those are in there. Those are in each of our rooms, both upstairs and downstairs, and in our triage rooms. If you guys are looking for consents, they are there in a red folder. Also, if your patient would like to take her placenta home, remember to have her sign our placenta release and waiver of liability form. They're in the file cabinet on the second floor. I may be revamping these soon, but in the meantime, just please remember to have her sign this if she is taking her placenta home. Last update, we're getting new ultrasound gel bottles. They're going to be single patient use. So if you use it on your patient, she goes home, please dispose of it and get a new one for the next patient. This will help so that we don't have to write the dates on any of our ultrasound gels, because that was one of our findings when our corporate team, our fake Jayco team came and toured the unit. I'm sure there will be other updates soon, but that's all I've got for now. See you guys.